Okay, this video is how to recover from a brain injury. There's tons of people that have traumatic brain injury. There's also tons of people that have psychiatry-induced brain injury. And brain injury for other reasons. You know, all the psychiatric drugs are bad. Okay, don't let anybody BS you about psychiatric drugs. Psychiatry is the worst field in medicine. All of their drugs cause brain damage and push the patient towards a lobotomy. The antipsychotics push them towards a lobotomy effect very rapidly. The antidepressants and benzodiazepines, it's a more gradual effect. If you're on psychiatric medicines, you do have to work with a psychiatrist to come off of them. Some good YouTube channels are things like Dr. Joseph. You can read the books of people like Peter Bregan, Joanna Moncrief, and other ones. But all psychiatric drugs are harmful to the brain. Now, I see a lot of people who've gotten brain injuries from playing sports, from boxing, MMA, from football, lacrosse, hockey, you know, all kinds of sports, soccer, heading the ball, from other things related to their jobs, whatever that might be. So anyways, no more head trauma. You have to stop with all the head trauma because that's just going to worsen the brain damage. And the important point, the most important thing you get out of this lecture is every day you're either getting a little bit better or you're getting a little worse. So you have to make sure you're getting a little bit better. And it takes a lot of time. But keep on pushing in the good direction and you can keep on progressing. There is something called neurogenesis, the formation of new neurons. And you're not going to form that many of them, not as many as you want. We don't know the exact number, but it's a gradual process. So neurogenesis, neuron, genesis, new, to form new neurons. Okay, but there's also synaptogenesis, forming new connections between synapses. There's also synaptic modification, augmentation, to increase the connection. Okay, so the point of it all is you want to do things every day that are building up your brain power. So what builds up brain power? Getting sleep. Get as much sleep as you can. Number 2, exercise a lot. You know, you have to figure out what you're able to do and just gradually keep increasing. And I think treadmills are a great way to go because on a treadmill you could really read. Your attention will be much improved because, you know, what's the purpose of a brain? To walk down a path in a forest or a jungle and to survive. So you have to pick a destination, you have to navigate, you have to avoid obstacles, you have to be on the lookout for predators. The point of it is that your attention span is improved so you're more able to read, okay? Because a lot of people with brain injury have a hard time concentrating, a hard time focusing. Well, you know, when you're walking down a path in a forest or jungle, you better be focused if you're going to stay alive. So when you get on that treadmill and you start walking, you'll be noticed your attention span will improve. So pick something that you enjoy reading. If I like a book, I can read easily 2 hours. But if the book's boring, then it's hard. So find something you like. And then gradually keep increasing the amount of walking you're doing. And then the treadmill is like a sleep machine. You're going to sleep better at night if you've walked. Now, don't get me wrong. You can walk in a path, in a forest, in a garden. A fun place to go to is the zoo. If you have a friend to go to the zoo, you can go, or you can go by yourself if you want, but going to the zoo is a fun place because in the zoo, you can walk for miles and miles, and it's fun to look at the animals. You want to read as much as possible. Reading really improves cognitive function. You might want to keep a journal of your progress, or you can make a knowledge management system. Whatever you're interested in reading about, maybe start writing a little article about it, eventually make a little miniature book about it. You don't have to publish the book or anything, but you want to show that you're building knowledge in an area. A good example of a lady who made a great recovery from a brain injury was Jill Bolt Taylor. She's got a TED Talk on it. She was a neuroanatomist who had a stroke. It was more like a hemorrhagic stroke. And the relevance is that she was hemiplegic on one side of her body. And what she did was she went to her mother's house, and all she did was try to improve a little bit each day. And she slept quite a bit. But after, I don't know, it was like 7 or 8 years, she made a full recovery. And what I'm trying to say is most stroke patients, they only rehab for about 3 months, if that much. Versus if you're trying to do a little bit more each day, every day, you can make a tremendous amount of progress way beyond what anyone would expect. But you have to be like that little engine that could and keep trying to do a little more each day, trying to do a little more each day. So you don't want to be distracted like in a job that burns you out. If possible, take a year off and just focus on rehab. If that's not available to you, then work in the easiest job with the least hours, the least stressful that you can, so you've got time to make sure you're getting your sleep, you're getting your exercise. Try to be in a positive social environment. Like what Jill Bolt Taylor did was fantastic. She was with her mother, and so she had the best support system you could have. And she sort of, nurtured her back to health. As far as sleep, don't ever take pills for sleeping, but, try to get your sleep. And I've given separate lectures, entire lectures on all the things you can do for sleep, okay? Avoid blue light at night, have your bedroom kind of dark, maybe even have these blue blocker glasses because your eyes perceive, blue light like the skylight in a sunny day as daytime. I'll put just a tiny little lamp on the ground in the evening so I don't have to look at the light, because if the light comes from above, it hits the bottom of your retina, that's perceived as daytime, whereas when it comes from the ground, it's like a fire, which is more red light rather than blue light, and it hits the top of your retina, that's perceived as okay. It doesn't affect your sleep. Really low watt light bulbs in the evening. Let's see, what else? Being religious, having a strong sense of purpose, those things lower your stress level. Avoid all unnecessary stress, because that's going to interfere with your sleep. You want to avoid all that stuff. Avoid anything that's bad for you, never smoke a cigarette, never eat processed food, eat low-fat vegan diet, okay? Let's see what else helps people to get better. If you have somebody you can have nice conversations with, great. Avoid things where you're at risk for traumatic brain injury, where you're maybe going to fall or something. Avoid all this leaky gut stuff, which just means eat low-fat vegan. You don't ever want to eat oil. Don't listen to all these high-fat, phony BS artists on the internet trying to promote oil. You don't want one drop of that processed crap with lipid peroxidation. You got to filter your water. Reverse osmosis filtration is good. Distillation is good, but it's very cumbersome. I've made entirely separate videos about water and how to handle it. Amyloid clotting, no alcohol, not one drop of alcohol. Avoid all the mitochondria inhibitors. I made separate videos on that. Basically, don't take any drug unless you absolutely have to. Discuss that in detail with your doctor. Never ever smoke marijuana. Marijuana's for chumps. It causes brain damage, okay? Anybody who tells you marijuana is good for you is an idiot, okay? Whenever I run into somebody who tries to tell me marijuana is good, I want to run out of the room. It's like, I got a lot of friends that are neurologists, and they tell me about one patient after another with brain damage from marijuana, okay? A good example is go to Dr. Joseph's YouTube channel. He's a psychiatrist there, and he says, patients have marijuana, then they get a schizophrenic breakdown, then they put them on antipsychotics, and they end up with a lobotomy, okay? That's a very sad thing, and it's much more common than is widely realized, okay? Avoid these estrogenic chemicals by be a minimalist. You want to live like Adam and Eve, but keep your indoor heating and plumbing. Don't be putting crap on yourself. You don't need shampoo. Maybe you need a tiny bit if you're a long-haired woman, okay? I don't have much hair, but it makes no difference if I use shampoo or just water, so I just use water, okay? No cologne, no deodorant, all that stuff is BS. You don't need laundry detergent unless you work on an oil rig or something. Minimize EMF, try to get rid of the Wi-Fi in your house if you can. Just hardwire everything. There's other types of EMF protectors you can get, an EMF protection bed and all that stuff to kind of ease your brain, to avoid the stimulant effect of EMF, whereby it opens up voltage-gated calcium channels in your brain cells, increased calcium influx into your brain cells, causes their activation. So anything that does that is bad. Don't only eat single ingredient organic only foods, because then you avoid all the MSG potentially added to it, or MFG, manufactured free glutamate. It's the same thing, same effect. Let's see what else. Avoid all these drugs. All recreation drugs are a disaster for the brain. All processed food is bad for the brain. Avoid all these toxins, so avoid anything that smells bad is bad for your brain. Okay, so those are some of the points, but the key point of all of this is avoid everything bad, and every day keep trying to improve your brain. Do a little bit more physically, do a little bit more in terms of reading, do a little bit more in terms of intellectual challenge, and maybe a little bit more writing. Maybe have a pen pal or somebody you can write to, or have an intelligent friend. When you talk on the phone, use your cell phone. Don't use a speakerphone. Don't be holding it to the side of your head. So if you become aware of it and you study, you can watch I made longer videos about rehabbing from traumatic brain injury. Just this attitude, I'm in this for the long haul. It's a marathon, not a sprint. I'm going to keep doing this every day for years. Your brain power will keep increasing. But if you just sit there and hope things will get better and you don't do anything, you're probably going to keep declining. So you need to push yourself. You're behind the 8 ball. And, somebody behind the 8 ball, you got to make extra effort. It's like I would tell students that weren't doing well, you need to study all summer vacation. They're like, every day? I'm like, yeah. Don't you want to become an expert? I would tell them you have to study every day during Christmas vacation, every day during Easter vacation. It's like, why not? If you want to become an expert in something, you should study it every day. okay? And they'll say, well, that's kind of over the top. And I go, yeah, well, you want to be the best, then you have to be over the top. The best people are always over the top. So, meaning you got to do more than other people. So if you want to recover from brain injury, you have to push yourself to recover. It's not just going to happen spontaneously, okay? So anyways, hope you found that helpful.